Okay, good everyone, and welcome back to the Neuroclarity podcast. I am Onoweri Victor, a neurology residency applicant, and today we're going to be doing some interesting questions. This content is adapted from Ching Ching's comprehensive review of clinical neurology. We're currently in chapter 2, and we've done questions 1 to 15, and right now we're going to be doing 16 and 17. So let's begin. Question 16. Which of the following is correct regarding the recurrent artery of Heubner? A. It is the penetrating branch of the anterior cerebral artery. B. It is the penetrating branch of the posterior cerebral artery. C. It provides blood supply to the thalamus bilaterally. D. Provides blood supply to the posterior limb of the internal capsule. And E. Originates from the main trunk of the MCA. So, straight up, the answer to this question is option A. It is the penetrating branch of the anterior cerebral artery. Let's start with the basics. The anterior cerebral artery is responsible for supplying the anterior three quarters of the medial surface of the frontal lobe. Think of it as the artery that keeps the inner part of the frontal brain alive and working. But that's not all. The anterior cerebral artery also sends off deep penetrating branches, and they are super important. These branches actually originate both proximal and distal to the anterior communicating artery. Among them is the recurrent artery of Heubner, which stands out. It is the largest and arguably the most clinically significant of these deep branches. Now, what does this artery supply? The Heubner artery and other anterior cerebral artery perforators supply deep brain structures, including 1. The anterior limb of the internal capsule. 2. The inferior part of the head of the caudate nucleus. And 3. The anterior part of the globus pallidus. These areas are crucial for motor and cognitive functions. So infarct here can actually have significant and distinct clinical presentation, including contralateral weaknesses, behavioral changes, or movement disorders, all depend on the specific territory that is involved. So let's do a quick clinical pair. If you see isolated motor symptoms, especially affecting the leg more than the arm or face, always think about the anterior cerebral artery territory. If a patient has a lacunar type syndrome but no cortical signs, infarction of the deep branches like the recurrent artery of Heubner could be the culprit. Damage to these deep areas can also contribute to complex movement disorders and even some executive function deficits. So, back to our question. Like we said, the answer is the penetrating branch of the anterior cerebral artery. So, think recurrent artery of Heubner, think penetrating branch of anterior cerebral artery. Question 17. The lenticulostriate branches provide blood supply to all of the following structures except A. Part of the head and body of the caudate. B. Posterior limb of the internal capsule. C. Putamen. D. External part of the globus pallidus. And E. The thalamus. So straight up from pick an answer, I'll probably just go with thalamus because in one of our episodes, when we talked about the artery of Percheron, we made mention that the thalamus has its supply from the posterior cerebral arteries. But let's try to take a look at this question and let's see how it goes. So A to D are parts of the brain that are supplied by the lenticulostriate branches, which are actually the branches of the middle cerebral artery. The middle cerebral artery has two main types of branches, the deep penetrating arteries and the superficial cortical branches. Let's talk about the deep penetrating branches, which is the lenticulostriate arteries. Now, these supply deep structures and they include 1. The putamen, 2. The head and body of the caudate nucleus, 3. The external part of the globus pallidus, 4. The posterior limb of the internal capsule, and 5. The corona radiata. Infarct in these regions typically produce pure motor strokes without cortical signs like aphasia or neglect. We also have the superficial cortical branches, and these branches spread out over the lateral convexity of the brain, supplying the lateral and inferior parts of the frontal lobe, the parietal lobe, the superior part of the temporal lobe, and the insula. Damage here results in the more classic cortical stroke findings, including aphasia, neglect, and gaze preference, depending on the hemisphere that is involved. Now, there are some things we should note. The anterior limb of the internal capsule is supplied mainly by the recurrent artery of Heubner, which we just spoke about, which is a branch of the anterior cerebral artery. The anterior limb of the internal capsule is also supplied by the deep branches from the anterior cerebral artery itself. The thalamus, however, is not supplied by the MCA. Instead, it gets its blood supply from the branches of the posterior cerebral artery and the posterior communicating artery. So, like we said, back to our question, the answer is E, the thalamus. It's important for us to realize that understanding these vascular territories helps us localize stroke quickly and accurately at the bedside. Once again, thank you for tuning in to this podcast. Stay tuned for more high-yield neurology discussions and see you next time.